My name is Carolina Niedebecka, and my stepfather, Richard, was a patient with LECOM hospice care. My stepfather suffered from congestive heart failure and really fought it for many, many years, and it was under control for a long time. And once his disease progressed to a point where we could no longer do anything else to help him, there came a very difficult moment laying in a hospital bed where he had to make the decision to go into hospice care. And that was a very difficult day for us. And I immediately made the choice to call LECOM, knowing that he was going to be taken care of. And one of the last things I said to him in that hospital room was that I was going to do everything I can to make sure that he was going to be comfortable and he was going to get great care. And that's exactly what happened. LECOM Health responded right away. They were in our home with all the equipment, with the bed, that same day. And once he came home, the care never ended. What really stood out to me was that they were very responsive to my phone calls. They answered every single time. They came to our home whenever we needed to make medical changes or whenever we needed additional equipment. They were extremely empathetic to my family. My mom, who was under so much stress and so sad, they really took care of her as well. One thing I learned about hospice care and LECOM's hospice care is that it's not just the patient, it's the family that also gets taken care of. There was a social worker that came and sat with my mom for a very long time. That same social worker actually still reaches out to her a few months later, once a month, just to make sure that she's okay and to make sure that she is, if she needs anything, that they are there to help her. My stepfather's passing is the first time that someone in my immediate family passed away. And one of the things that I've learned with my mom and my stepbrother is that once the funeral is over and once all the family members go back to their homes and the friends kind of stop checking on you, you end up sort of feeling alone in your grieving, and everyone grieves in a different pace, in a different way. And so the reason why I'm interested in attending this event is because I want my mom to see the community of people that come together and that she's not the only one that is left feeling very alone and feeling very sad. And sometimes that sadness just comes out of nowhere. And so I think that we're going to look forward to spending a day with other people who have had similar experiences, to share our stories, to talk about our loved one, and to honor them. I really look forward to releasing the butterfly. I've always loved butterflies. I think they signify so much. And I think in the moment, what I want to do is make a wish for my stepdad to be at peace, to be pain-free. And I hope that he's watching over us from somewhere and he can see that butterfly. And I think it will make us feel connected once again. And that's what we look forward to.